Hello everyone, I am Dr. Sarita Channawar, practicing obstetrician and gynecologist at Wockhardt Hospital, Mira Road, with a work experience of 10 to 12 years. Today I am going to speak about cervical cancer. Cervix is a part of the uterus, basically the opening of the uterus which connects the uterus to the vagina. And cancer of the cervix is one of the very common cancer in the women. How these women will present, which can lead us to suspicion of cancer. Basically, there can be bleeding after menopause, that is stoppage of the menses. There can be bleeding after intercourse. There can be white blood mixed discharge, which can be of foul smell, and there can be chronic pelvic pain. So, with these symptoms, if the lady is present, sometimes the cervical cancer is in its advanced stage. An early stage cervical cancer may be mostly asymptomatic. So for this reason we need a better screening method, and unfortunately for cervical cancer there is a very good screening method which is available, which is a pap test. It is basically a cytology test where a specimen is taken from the cervical opening and spread as a smear on the slide and sent to lab, which can detect the cancer cells. So as a health checkup also, women can undergo this pap test, which is very easily available, and we at Wockhardt are regularly doing it as a part of the health checkup for women. One more fortunate thing for cervical cancer, that a vaccine is available, and the vaccine is gives 100% protection if taken in the adolescent age of 15 to 18 years. So basically this vaccine is a vaccine against the HPV virus, which is a causative factor, human papillomavirus, which the exposure starts after the sexual activity. So HPV virus being the causative factor, the vaccine protects against this HPV virus types which cause the cervical cancer. So this vaccine ideally should be given in the adolescent girls, but yes, women of the reproductive age group also can be receiving this vaccine, but the efficacy may not be 100%, but up to 70 to 80%. If diagnosed in the early stage, cervical cancer can be effectively treated with surgery as well as other treatment modalities. So during this cervical cancer awareness month, a very important message I want to give to all the ladies, that consult your local doctor or a gynecologist who can do this pap test for you, and routinely do it every year as a part of health checkup. And once 3 consecutive pap smears are normal, you can reduce the frequency to every 2 to 3 years. So and also spread this message among your friends and relatives, and so that maximum ladies can get themselves tested with this screening test of pap smear. Thank you.